I'm going to add someone to the conversation here. Joining us now via the Doctor on Demand, it's a company that my son and I have started. Dr. Ian Tong, who is the Chief Medical Officer at Doctor on Demand, is with us right now. I've asked you to take a look at some of the labs and what's going on here with Andrea. What do you see when you look at the results here, and with regard to the liver?
With the lab results that we saw with Andrea was it became clear that there was an elevation in the liver enzymes that were really more than double the normal value. And when we see that happen, that is actually a pretty strong clue to a clinician or a doctor who's making an assessment to be able to say their relative risk of death within either a short period or a longer period of time. So I'll give you an example. With the labs that we saw, it did show that the ratio of those labs suggests that there is a hazardous habit of drinking alcohol and what's called an alcohol hepatitis. So that means inflammation of the cells of the liver. We can see that by that lab work. There are also, as I said, physical examination findings, and then the history being consistent. We could make a pretty accurate prediction about the risk that she would have of dying within the next year.
And Dr. Tong, let me ask you this final question just to be real clear for everybody. Death by liver failure is not an easy way to go, is it?
It's a very painful thing for a family, and actually for the caring physicians and for the patient. There are a number of things that can happen along the path. You can actually lose the ability to think clearly, so your cognitive function is decreased. You can suffer from GI bleeding, and patients are actually more likely to have infection as well. All of these medical conditions and risks are heightened when someone has problems with alcohol abuse that has damaged the liver.
Dr. Tong, thank you. Thank everybody for their research at Doctor on Demand. We'll talk to you soon.
Great. Thank you, Dr. Phil.